Hello, everybody, and welcome to another episode of the Dentistry Podcast. I am your hostess, Elizabeth Stewart Anthony, and I have with me today the awesome Dr. Radfar.
Radfar.
Radfar. Oh my God, what an idiot! It's Jafar, right? No, I love when I mispronounce it. A guest name like straight out of the gate. It's going to be a great interview. Um, but we met at the dental festival, and you got it going on, man. You know, you got your red supplements. Um, you're so down with the whole with sleep and how it affects, mental health. And you also introduced an amazing new product that for dental professionals, the cold laser. So I love people that are out there walking the walk. And, it's what I try to do every day. So welcome to my podcast.
Thank you, Elizabeth, for having me on. We got to keep going in this rad life of ours, right?
Right?
We gotta keep producing, creating, and leading with our hearts when we treat our patients. Let alone for those listeners that do treat patients, I'm going to give you guys some real good, insightful information on how sleep affects so many things in our medical and mental well-being,
Yes.
how we can help with patients clenching and grinding and jaw issues using supplements and low-level laser therapy. And so at the end of the day, we've learned stuff in school to be able to present for our patients, but we've got to advance that teachings that the learning that we've had, and go to a different level. And that different level involves a much more comprehensive approach of looking at why a certain person has high blood pressure or has acid reflux. Why are they grinding their teeth? So I'm really excited to talk to you about all that.
Well, and what's interesting to me is these people that you're talking about, these are the same patients that present as hostile, that present as angry, that, and then somebody's bitching about them in on a Facebook group. Oh my God, I had this red person, blah, blah, blah. But, people who can't breathe, can't sleep, how do we expect them? They're coming into our practice with lacking in executive function. Okay, they're in fight or flight, and we're coming at them with all this information and expecting them to process. And what happens is you get into a power struggle. The patient's presenting as the patient presents as belligerent, argumentative, but the real reason is that they're fearful, they're afraid. So then, the professional reacts to that, and it just gets into a downward spiral. And it just can't. And these days, that can lead to a bad Google review. And whenever I see my fellow professionals complaining about bad Google reviews, I'm always interested in, I wonder what that patient's mouth looks like. Do they have tori? Are these people that are brushing and grinding are the same people that don't want x-rays? Right? So you and I are talking about the same people.
Yeah, and it's brilliant that you mentioned that when these patients come in and they're not in the mood, whether they're not super happy, glad to hear your treatment plan, which is probably a lot of them. There's a lot of things that are going on internally with this patient that we have no idea about. That's why
Yes.
it's, dental practices, hygienists, staff, or doctors that take things personally because someone has attitude. That's not leading with compassion or empathy. And that really gets under your skin and makes your day a really horrible day. Like, why would you want to live your life at the office having someone else's energy affect your being, where you still have 20 plus other patients to service, and you still have to go home and be a
Right.
mom, a dad, a husband, a boyfriend, a child, or a kid to someone? At the end of the day, we have to understand that there is a possibility that they're sleeping poorly and they're not breathing well and getting the effects of mental health, meaning depression, anxiety, fight or
Yes.
flight response, as you mentioned, right? These are all affect people's energy and mood. and their happy-go-lucky feeling, let alone they're not as happy-go-lucky to come see us sometimes, right? So we have to have understanding that there could be an underlying cause based on the fact that they're not getting enough oxygen when they sleep, and there's
Mhm.
a race of their heart to get oxygen to the brain, and there's a kind of like a really a grumpy feeling that you have in the morning, and we've all had it, right? I mean, you don't get
Right.
good night's sleep 7 days a week. The next day, the last thing you want to do is be kind and nice to everybody around you, especially the dentist that just said you have this and this that you need to do, and you're just there for your cleaning, right?
Right, right. Oh my gosh, and I love what you just said, and, that leading with compassion, that's what serenity is. Serenity the serenity is based on the serenity prayer, right? God grant me the thing, courage to accept the things I can't change. I can't change that patient's history. I can't change really much about them at all. The thing I can change is me, and learning to and leading with compassion, with empathy, with non-judgment. That is the key to a positive interaction, and it starts with what you just described. Understanding that there's a whole, it's not just this person's teeth, it's their whole body. We're treating a whole person.
Yeah, and a lot of this is you see a patient grinding their teeth, and you automatically go, "Are you wearing a night guard?" And that's the kind of a wrong response. The
Right.
proper response to this visual thing that you see is, how well do you sleep at night? Do you feel you get
Yeah,
enough oxygen? Are you tired? Because that fight or flight response can cause the clenching and the grinding. And
absolutely.
the other issues are, sure, stress and anxiety and living on this planet. uh, for some people it's over the top, managing so many things, and yeah, we can provide them with treatment, but it does take some time to understand, letting them vent and talk to you about what's going on, so that you can properly treat them. I do half the time where there's a TMJ patient, it's a sleep related issue, and that becomes a home sleep study, and
Yes.
then an impossible CPAP or a oral appliance that positions the airway, or the mandibular jaw more forward to open the airway more. So that's not a night guard for that patient. And that's why you got to dive in, look at their medical history, see if there's any comorbidities or issues that are really caused by sleep apnea. And that could be a red flag, as opposed to just doing, a night guard, maybe even Botox treatment. You got to see if it's a sleep issue. So the conversations have to be had. It's not just, you grind your teeth, here's a night guard. If you don't get it, we're doing more crowns. Listen to me now. I
Right.
know what's right for you. And they're
Oh
looking
my
at
God,
you,
yes.
okay.
Yeah, that authoritarian medical model of like I'm the expert, and you need to listen to me because I know more than you.
Yep.
I tell my patients, I'm like, when you ask somebody, do you grind your teeth? They're going to say, first of all, they're going to say no. Second of all, it's not like they're doing it on purpose because it's fun. I'm like, you're not grinding your teeth. Your teeth are getting ground by your brain. Okay, your brain is going to open that airway no matter what. So this whole thing about, yeah, night guards. Oh, please.
Yeah, it's a little bit challenging to just go directly with an accusation. It's more like, hey, I've noticed there's some wear on
Yeah.
your teeth. The lower front teeth look like they're wearing down. You may be doing some sort of like movement with your jaw while you're asleep, and grinding your teeth forward, trying to get more air. Has anyone tell you that you snore if you have a bed partner? Do you feel more tired throughout the day? These are the light-hearted, I call it, conversations about a serious underlying issue. And again, Elizabeth, you and I know both that they could say, "No, doc, I sleep great. I'm just here for my cleaning. No, doc, I'm doing fine." And then, okay, no problem, Elizabeth. If anytime in the future you notice anything with your sleep pattern that's being affected, someone tells you they hear you snore or gasping
Hmm.
for air or something like that, let me know. Have a great
Hmm.
holidays, and I'll see you soon. And then
Yep.
they come back 6 months later and they're like, "Hey, you were talking to me about that sleep thing, and now I'm noticing that I gained more weight, or I'm more tired throughout the day. What can I do about that? I don't want to wear
Hmm.
that mask." Boom. It's plant the seed, right?
Yep. Yep. and try not to, you know, beat them over the head with it, and try to be kind.
Yeah, and we try not to beat them over the head with the fact that they need that implant on the lower right. Otherwise, the teeth start shifting, or you chew on the other side, or that tooth is, broken, or is close to the nerve, and they need that treatment. You tell them what they need, and give them the information of what if you don't do this, what will happen. And when it comes to sleep apnea, the ramifications of not getting tested and treated are way worse than anything dental related, because you're looking at 5 times higher risk of cancer of any kind if you're left untreated, 12 to 15 years off your life expectancy if you're left untreated, higher rates of heart attack, stroke, depression and anxiety, acid reflux.
Yep.
So there's a lot of let's call it comorbidities, what it is, that can be associated with it, and we can definitely help mitigate and lower the chances of these issues just by looking in the mouth, looking at the medical history, having a conversation with the patient. And the medical history is high blood pressure, history of heart attack and stroke, history of cancer, type 2 diabetes, acid reflux, medications for depression. Those are all conversations for, hey, Elizabeth, how well do you sleep at night? Do you feel like you get enough rest? Do you want
Mm-hmm.
me to help you if you're not? And the stuff in the mouth that we look for are very simple wear patterns of your lower front teeth being ground down, scalloping of the tongue, large scalloped tongue.
Yep.
If you don't see the soft palate's a little more droopy, you don't really see the uvula or that punching back there when they open their mouth. It's
Right.
more sagging, so to speak. That means that there's could be constriction, and that airway restriction or constriction can be helped by yours truly, a dentist and a hygienist, and staff members of a dental office that can provide education and then ultimately fabricate a custom mouthpiece. The alternative is surgery or CPAP machine.
Mm-hmm.
So, we're the ones that look in the mouth every 3, 4, 6 months. The hygienist there, you have such power. Once you help one patient, maybe even it's a family member of yours, that you can have the dentist learn how to do. And that's what I do. I now teach other dentists through radseminar.com to be able to get trained on how to be able to do this stuff, so that we can really, really provide total health and wellness for our patients through an application of a sleep appliance.
What sort of talk to me about your appliances?
Yeah, so the appliance that I use personally most for patients is one that's, let's call it a generic one, that is custom made by most dental labs or labs that provide a Medicare approved sleep appliance called the Sleep Herbst appliance.
Mm-hmm.
I don't have a rad appliance made. I don't have a one that I promote. I do have a sleep supplement that I created. You mentioned supplements earlier, that actually helps with snoring and sleep apnea. The ingredient N-acetylcysteine is an ingredient that I've put in Rad ZZZ. That's the supplement that I have. One of the
Awesome.
ingredients, yeah, along with magnesium glycinate and valerian root and tryptophan and very trace amounts of melatonin. What we've noticed, the combination of all these have able to have patients or people sleep better, sleep longer, and wake up feeling refreshed, and not having a hangover feeling that Xanax and Tylenol PM and Benadryl and Advil
Mm-hmm.
PM and all these other ones that are liver toxic and
Mm-hmm.
kidney toxic that people are using, or alcohol. It's better to get on. If you need some help calming the mind, Radzies was created, and there's plenty of other types of sleep aids out there that can help a patient.
Magnesium glycinate. So I just started taking that myself. Read about it and saw about it on Instagram, and yeah, that's pretty awesome. And magnesium is implicated too in a lot of headaches, right? When you go to a naturopath, a lot of times they'll prescribe magnesium for people with migraines.
Yeah, so the magnesium glycinate is also in one of my other supplements called Rad Jaw. Rad Jaw came out a few years ago when COVID hit, and everyone was really kind of anxious and stressed,
Mm-hmm.
and came to my office with jaw pain, and popping and clicking of the jaw got worse, and And so what I realized that a bunch of ingredients help with joint jaw therapy and but magnesium glycinate was one of the bigger ones, along with MSM, fish oil, chondroitin sulfate, glucosamine. All those in rad jaw help with tightness of the muscles of the jaw and the
Yes.
temporalis, which migraines can be induced by the clenching factor. That obviously that's not the only thing. An occlusal splint or a sleep appliance, if it's sleep apnea induced grinding, it has to also be provided. We also do Botox now for the masseter and temporalis to lower the intensity of the clench and contraction to
Nice.
help with headaches and protect the teeth. So, these are the type of conversations. You can't just give a night guard and say wear it and you'll be fine.
Hmm.
We do have to look at the other options, such as supplements that are very relatively inexpensive and help with not only the joint but also the muscles as well.
So I see, as an orofacial myofunctional therapist, I see a lot of people with TMJ dysfunction, and by the time they get to me, they've already been through the mill of, they've gone from their dentist to an oral surgeon to this one to that one, and a lot of the things that you and I have noticed with bruxing, and they they've been to all these other providers, and some of the other providers seem to have not put the puzzle pieces together. And I'm thinking of this one new client I have. This poor woman has been suffering for years, and she's had all these medical tests, and you know and she's in pain, and it's like, well, you're okay. So now they're starting to, now she thinks she's crazy, and she's and now she's got providers hinting strongly that she might be. So that just makes me really sad.
Yeah, getting a little spiritual on you, Elizabeth, and I know you like this kind of talk. There's a thought process that you can't be in an anxious state and a gratitude state at the same time. That's been researched. And so I have a lot of patients who, quote unquote, or people who, quote unquote, think they're going crazy. And we are all going a little crazy with what we deal with.
Mm-hmm.
Let's be real. And crazy means that we're just handling so much, trying to be a mom, a dad, doing our jobs, trying to be a partner, and self improvement physically, mentally, emotionally. It's a lot. It's a lot to be able to be conscious and aware of. But when you're in a gratitude state, meaning you actually take some time in the evening before you go to bed, or even in the early morning, you wake up at 4:52 a.m. and you're wondering, why are you awake at 4:52 a.m.?
Mm-hmm.
Instead of grabbing your phone, it'd be nice to grab a journal or a piece of paper and a pen by your bed, keep it there, and just right away write down 10 things that you're grateful for. It's
Mm-hmm.
amazing when you get to number 5 or 6 or 7, you get like a little bit of writer's block. And it's like, do you have feet? Do you have eyes to see? Do you have a car, a roof over your head, healthy family members, food on the
Mm-hmm.
table last night? Um, all these things that we're able to be grateful for, that will reduce the intensity of the anxiety and the fight or flight response that we constantly live with, and perhaps even reduce the clenching intensity when you're doing this at night, that that you fall asleep in a gratitude state a little more. Therefore your bruxism and your anxiety during the night will hopefully be less. Now again, if the airways kept open, you're not struggling to find air, that itself will can counterbalance the gratitude state that you fell asleep in. So there's a little bit of a component of, you mentioned psychological issues with this patient. It could take medication. It could take anti-anxiety medication to calm someone. But the goal is to prevent yourself from getting there. And anyone who's anxious, anyone who doesn't sleep well, my recommendation is reach out to me. Find me, and I'll help you with a home sleep study through a company that I use. Get your sleep evaluated first, making sure your airway is kept open while you're sleeping, and then we can go and say, okay, no, it is stress and anxiety related, maybe medications, maybe therapy, or journaling. All these things are perhaps necessary to be able to live a somewhat positive, happy life.
Wow, that's amazing. And so like what's the CDT code, right, for that, right? What's the CDT code for recommending a journal, a gratitude journal? There's there's so much there's so much that we could do that we just, and dental people, we're under a lot of pressure during the day. We for production, for time expedience, and a lot of times, these things that you and I are talking about feel like they're add-ons that they just don't have we don't have time for. But
Right.
I really honestly think that when you do and they're not even it's not an add-on, it's like an attitude, right? And
It's a
that,
it's a way of being that you need to. We don't get taught this in school. We don't get taught this from our parents, at least not the generations from the past. And
right.
now, introducing some sort of mindset, and the mindset is not just this foo-foo think life is manifesting positive. You actually have to do the work and understanding perhaps how to focus on your breath for 2-3 minutes a day when you close your eyes. Just oxygen going in, oxygen going out. Good luck. Try doing that without having 15,000 thoughts come into your brain
Mm-hmm.
while you're trying to focus just on inhale and exhale. And these are the ways that when society has gotten more complicated, it's up to us as an individual to not, there's no CPT code. There's no a proven way that if hang upside down and meditate and sage your house and do all these other things that you are guaranteed that you will sleep well tonight and everything will be bliss. Life is suffering. We are given the opportunity to crave things, which if we don't get, we suffer. We hold on to things. So the counterbalancing of acceptance and compassion and kindness towards ourselves and eventually towards hopefully others shifts your energy a little bit more out of the fear mindset and the greed and anger and the resentment towards possibly courage and eventually towards loving thy neighbor, so to speak, which is been a thought for thousands of years now, right? And so
Right.
even our energy, if you start talking about compassion and love more and how much that's needed in the world, you notice your heart rate go down a little bit. You're not as tense. So imagine doing that before you sleep. If you have
Mm-hmm.
some compassion and empathy towards yourself by showing gratitude, it's not going to stress you out more. It's only going to do good. And as you said, there's no textbook page number 327 that explains this. It just makes sense physiologically to do so.
And taking 2 or 3 minutes at the beginning of the appointment to just breathe with the patient, right? Okay, let's just do just a few breaths. I think that alone would help. you know we want to bring down that response, right? When people are in fight or flight, they're super reactive, they're defensive, and just a couple of minutes of breathing could bring that down.
Yeah, and one of the biggest things that I've done in my office when I see patients is I thank my patient right away. I show gratitude for them being there that day. So I will tell you, Elizabeth, so nice to see you. I'm so happy that you were able to come in today. How are you feeling? How are you doing? That sort of compassion right away,
Yeah.
even though my day is extremely swamped and the crown cracked in the other room and the other patient showed up late, so I'm behind schedule. It's the same song and dance that we need to do, is to thank and appreciate them showing up. Look at you'll notice the mood, the attitude, their arms being crossed get uncrossed in the chair.
Yep.
Their semi frown turns into a smile. And you are a leader. You have to lead in your office, whether you're front office, whether you're a hygienist, with that kind of kind mindset of, so nice to see you again. Thank you for coming in today. Hope you're having a great day. How are you? You know, that takes 6 seconds. Put it
Right.
on repeat.
Right. 6 seconds, and it's win-win,
It is.
right? And yeah, I love to hear you say that. And I wish that was the mindset across everybody in our profession, because I think we'd all be a lot happier. There'd be a lot less suffering on both sides of the chair.
Well, Elizabeth, when you don't do this at home with your kids or with your friends or your partner, when you don't you don't do this for yourself. When
Yeah.
you wake up in the morning, if you don't thankfully say, "I'm so glad I woke up today. I'm able to get ready and to go and try to provide some sort of very challenging service to humans," and mind you, still be a dad, a mom, this,
Hmm.
but I'm still very blessed to do so. How are you going to be able to do it to your patients when you go into the room? I mean, you can't just turn it on. You have
Right.
to have this as a lifestyle or a way of living, and it's not foo-fooey. It's not playing with your mind. It's the only way to being, so that you can conquer the day and the stuff that comes at us.
I completely agree. I learned about a lot of this in a 12-step recovery program, where prayer and meditation is part of your step work. So, and an attitude of gratitude. So a lot of these things that we're talking about, that's where I came across these concepts, and making them part of my daily life. And I'm really grateful for that. A lot of people just don't they don't have the impetus to push them to do that, right? Everyone's just kind of running around, and
The go people are growing a little bit more conscious now. There is an awakening that's happening. I think you and I connected, well, because I saw how much empathy and compassion you have, with what you're doing with your ideologies of how to be able to help dental professionals, and their patients ultimately. And I think that 5 years ago, we were not having these types of conversations about
right.
compassion and empathy and understanding, how to have a positive mindset, because ultimately epigenetics is real. You live in the negative, you will change your DNA for the worse. It'll lead to cancers and disease and depression and anxiety, uh, and nobody can do this for you. No one's here to save you, Elizabeth. It's up to
Right.
you to
Right.
save yourself, and the universe will allow you to feel those rewards when you actually do change your mindset. And that's why I'm such a big believer. And you cannot just do crowns and fillings and SRPs and prophies and send the patient out. You really need to look at the medical history in the
Hmm.
mouth, look to see if there's signs of struggle for air, that we talked about earlier, and if there is, be brave enough to put your hat on as a caring practitioner, not caring about what the patient is thinking financially, but caring about the fact that you could literally save this person's life with one comment and them going, "Oh my God, yeah, I don't sleep well and I don't know what to do." And that's my passion, my purpose, with my products, from the Rad Health program that I have, the coaching program that I have to teach how to do this in dental practices, so that anyone can be successful in doing it, and ultimately helping these people, not fall asleep at the wheel. And going to that, I think I remember telling you, you heard me
Right.
speak on stage. I'm in this because I did fall asleep at the wheel in
Yeah.
2009. I crashed my car into a tree, not knowing I was going to be patient zero, sleep apnea at my office. And so imagine if I crashed into somebody else, or a human, or a car.
Hmm.
Where would my life be now? And so I want to prevent that small percentage of crashes that people fall asleep at the wheel. You have the power to prevent that, let alone all the medical stuff that we discussed.
That's amazing. So you're taking a negative and you turned it into a positive. It's sort of like hitting a bottom and deciding that you need to make a change. And that's exactly what you've done. And I freaking love it.
Yeah,
Um,
I mean, it's only we can. If anyone else could make an appliance, I would go to that person and say, "Hey, help me," and then I would be the advocate for that person because they've helped me snore less and sleep better and have that energy for my kids, for myself throughout the day, and be not as grumpy in the office when I'm seeing patients, and be able to even try to have a positive mindset. It's almost impossible without getting good sleep. So, but now that we have the power as dental professionals to not only screen patients, refer them for home sleep studies, and then get the results back, be the messenger, and then say, hey, you want CPAP surgery or an oral appliance? And then guiding them into an oral appliance, especially if they're mild to moderate patients of apnea. I mean, how easy it is to do that. The dentistry is very easy. It's more the understanding, the systems in place, which I help offices do.
that is awesome. Um, uh, one, so at the dental festival, I was talking to the two guys from the laser company,
Yep.
and we were talking about, so chiropractors have been using that technology forever. And I had a couple of patients who were one, his wife was a chiropractor, and one was a chiropractor himself, that were able to improve their they had tongue restriction, but they were able to improve their melon potty just with external applications of that laser. And I was telling them there's a lot of focus on tongue restriction, and there's a lot of people who, for whatever reason, are not going to get their tongue released. And here's another way to help with that.
Yeah, low level laser therapy, and I'm the KOL, key opinion leader for Erconia Laser. Now we're bringing it into the dental world, and you saw that at the dental
Yep,
festival
yep.
in Key West, Florida. It's being used for. I use it for my TMJ patients to reduce postoperative pain after an extraction or implant. It's used for or any sort of dental procedure that you do. You just point and shoot the laser. You don't have to
Yep.
numb the patient. It's a cold laser. It's
Yeah.
set at a different frequencies for different kinds of things. The chiropractic world, as you mentioned, is we've been using it for all the rest of the body for years now, FDA
Yeah.
clearance for postoperative pain. And so now we're using it for sleep apnea. It can help with under the chin fat reduction so that
Ooh,
you have,
uh-huh.
yeah, that's one. And then 4 treatment sessions, 1 week apart. And then also with biting on a bite block, shoot the laser in the back of the soft palate where you were talking about malum potty or the droopiness of the
Mm-hmm.
soft palate.
Mm-hmm.
It'll make the palate more taut as opposed to more sagging, and
Yeah.
therefore creating more distance between the tongue and the palate. Again, 4 sessions of both the under the chin, each session is about 5 minutes per. So patients in and out in less than 15 minutes. 1 week apart, we notice significant improvement. And of course, there's a lot of other variables that come in, but what an easy thing to incorporate into a dental practice
Yes. Oh my
on top of
God.
the TMJ applications, uh, neck and shoulder pain. I mean, dentists themselves can use it on their shoulder, their arm,
Mm-hmm.
their back. While waiting in between patients, you put it on for 10 minutes. You do a couple sessions, you'll notice that you're not as much in pain. The lasers stimulate the mitochondria to produce ATP in your cells. So an ATP is the powerhouse
Yep.
to be able to promote healing, to reduce pain, has an opioid effect, and also all that combination together, you just get a happier patient. So it's a wow effect as well.
That's awesome. I'm glad you're out there speaking about it, because dentists need to know about this technology. It's, can really, really make a big difference in the quality of life for patients. And so good on you. And you had that Darth Vader costume on at the
Yeah,
dental
I showed up to
festival.
the festival wearing the outfit of Darth Vader with since my first name is Dar, just add a
Right.
to the end.
That
So
was
I showed up as
great.
Darth Vader, pointing the laser, and it could, obviously can be pointed anywhere. Just don't point at the eye. But it was just fun to introduce this to dentistry. And one of the things we're working on with this laser is I'm doing the FDA clearance study, the 510K study research starting in December of this year. It'll
Hmm.
go on for about a year. We're going to show that we believe that there's a high probability it'll show gum recession and gum growth by about 1.5 to 2 millimeters just by using the laser alone. Yeah.
What?
So that
No,
itself will
really?
revolutionize dentistry to be able to not have to do gum grafting or a pinhole technique.
That's
um,
amazing.
that will do a lot. So yeah, so that's new research pending for 2025. Even if it doesn't show that, there's that again. We talked about the applications of TMJ, reduction of pains, soft palate, chin fat, all that stuff can help tremendously in a lot of things we do in dentistry.
That's amazing. Um, and I also will never forget your talk at the dental festival when you were talking about being a little boy and riding the horse in the mountains of Afghanistan. That was like that was so amazing. And
Yeah, the childhood trauma, so to speak, at the age of 6 when I escaped my country it was actually from Iran into Turkey.
oh,
It
I'm
was
so
a
sorry.
Yeah, it's okay. It was definitely eye-opening and understanding how important our how blessed we are to have today. And if you're worried about what's going to happen on this weekend, you don't even know if today's going to happen. I mean, my life got uprooted and just completely. I didn't know I was escaping my country on one evening, and to be put on a horse and told, watch out for snipers and don't fall asleep off the horse. If you fall asleep, you're going to die. And sleep
Yep.
resonating in my head, don't fall
Yes.
asleep. And
Don't
of
fall
course,
asleep. Yep.
full circle in 2009, I did fall asleep. We fall asleep sometimes in the couch. We fall asleep, as the passenger, hopefully not as a driver like I did.
Right.
But then there was an underlying cause, and that was because I've had mild sleep apnea. And so all these, traumas, as they call it, can be positive attributes towards your life as long as you look at it as a reason for you learning a lesson and pivoting and trying to be able to serve others from your gift that was given to you to prolong to come forward in life, whether it's an escape from a country or a disease you fought or fighting. Speak your voice, and hopefully it'll help at least one other person on this planet.
You know what? That's my goal, right? That, I always said, nobody's going to leave my chair in pain and ashamed. And that's that's what I try to do, right? Day in, day out. And I know you do it too. And I'm really so fortunate. I'm so happy that we met. I so I we've corresponded in different Facebook groups, but it was so great to meet you in person at the dental festival. And it's really, really great to talk to you today.
Thank you. Yeah, thanks for having me on. And if any of the listeners need any help with anything that we discussed, you guys can email me my first name, last name, Dar Radfar at gmail.com. Radhealthinc.com is the products that I have. And then radseminar.com is if you want to get trained on how to do this stuff with sleep and all the products and how to incorporate it. I'd love to help the lasers, all that.
That is awesome. Rock on, dude. Keep doing what you're doing, and I hope I run into you soon.
Thank you. Thanks, everyone, and stay rad.
All right, stay red.